Diabetes is one of the most common and serious chronic diseases affecting Filipino families today. It is often treated as a problem of high blood sugar alone, but diabetes can eventually affect the heart, kidneys, eyes, nerves, blood vessels, and feet. It may lead to heart attack, stroke, kidney failure, loss of vision, chronic wounds, amputation, hospitalization, and premature death. The burden is not carried by the patient alone. The entire family may be affected by the cost of medicines, laboratory tests, consultations, hospitalizations, special food, transportation, and treatment of complications. Family members may also become caregivers. They help prepare meals, monitor blood sugar, organize medications, accompany the patient to appointments, and provide emotional and financial support. For many years, people with type 2 diabetes were made to believe that the disease would always worsen. They were told that medications would continue to increase, insulin would eventually be needed, and complications were simply part of the future. Today, we understand that type 2 diabetes does not always have to follow that path. Diabetes remission does not mean that the disease has been permanently cured. It means that blood sugar remains below the diabetic range for a period of time without glucose-lowering medication. Continued monitoring and a healthy lifestyle are still necessary because diabetes can return. One of the greatest challenges for people with diabetes is the confusion surrounding food. Patients often receive different and sometimes conflicting advice. One person may say, avoid all carbohydrates. Another may say, eat more protein. Someone else may recommend a very low carbohydrate diet, intermittent fasting, meal replacements, fruit restriction, or complete avoidance of rice. Many patients become afraid to eat. Some avoid fruits because they contain natural sugar. Others remove rice but replace it with large portions of meat, processed food, cheese, or high-fat products. Some believe that brown sugar, honey, coconut sugar, or so-called diabetic products can be consumed freely. Others skip meals, follow extreme diets, or suddenly reduce food intake while continuing the same dose of insulin or medication. This can be dangerous. The truth is that there is no single diet that is appropriate for every person with diabetes. A safe and effective nutrition plan should consider the person's blood sugar pattern, medications, kidney function, liver health, body composition, food preferences, culture, work schedule, access to food, and other medical conditions. Carbohydrates are not all the same. Whole grains, beans, vegetables, and whole fruits affect the body differently from sugary drinks, refined flour, pastries, sweets, and highly processed food. Patients also need to understand portion size, meal timing, food quality, fiber, fat intake, and how different meals affect their own blood sugar. This is why simply telling a patient to eat less sugar is often not enough. Diabetes remission requires a structured and medically supervised approach. Lifestyle Medicine Solutions offers the Diabetes Remission Program, an intensive program for eligible adults with type 2 diabetes. The program is implemented and supervised by Lifestyle Medicine Intensivists, physicians with advanced training and clinical experience in treating complex chronic diseases through intensive lifestyle intervention. Our lifestyle medicine intensivists work together with endocrinologists, primary care physicians, cardiologists, nephrologists, dietitians, diabetes educators, and other members of the healthcare team. The program does not replace specialist care. It strengthens the patient's existing treatment plan by addressing the factors that contribute to insulin resistance and poor blood sugar control. Every patient begins with a comprehensive medical and lifestyle assessment. We review blood sugar results, HbA1c, medications, insulin doses, blood pressure, weight, body composition, kidney and liver function, sleep, stress, physical activity, eating habits, and possible complications. The patient then receives an individualized plan. This may include therapeutic nutrition, structured physical activity, resistance exercise, sleep improvement, stress management, behavioral support, weight management, blood sugar monitoring, and careful adjustment of medication. Medication supervision is especially important. When food intake, physical activity, and body weight change, blood sugar may improve quickly. If the same dose of insulin or medication is continued without proper monitoring, the blood sugar may fall too low. For this reason, patients should never stop or reduce their diabetes medications on their own. Any medication adjustment must be supervised by a qualified physician. At Lifestyle Medicine Solutions, we have seen patients achieve major improvements in blood sugar control through intensive lifestyle intervention. Some have significantly reduced their insulin requirements. Some have reduced or discontinued certain diabetes medications under medical supervision. Others have maintained blood sugar levels below the diabetic range without glucose-lowering medication for a period of time and have met the clinical criteria for diabetes remission. These are individual clinical outcomes, and remission cannot be guaranteed. The result may depend on how long the person has had diabetes, the amount of remaining pancreatic function, current medication or insulin requirements, body composition, existing complications, and the ability to maintain the recommended changes. Even when full remission is not achieved, meaningful improvement is still possible. Better blood sugar control may reduce medication requirements, improve energy, protect the heart and kidneys, lower the risk of complications, and improve quality of life. The goal is not simply to reach a lower number on the glucose meter. The goal is to understand why the blood sugar is elevated, address the underlying metabolic problems, and help the patient build habits that can be sustained. The earlier intensive lifestyle intervention begins, the greater the opportunity for a successful outcome. Do not wait until insulin requirements continue to increase. Do not wait until kidney function declines, vision becomes affected, or a wound develops on the foot. If you have recently been diagnosed with type 2 diabetes, or if your blood sugar remains uncontrolled despite medication, speak with your attending physician about whether an intensive diabetes remission program may be appropriate for you. At Lifestyle Medicine Solutions, we help patients move beyond confusing dietary advice and general recommendations. We provide clear, individualized, medically supervised guidance that considers the whole person, not only the blood sugar. Diabetes remission may not be possible for everyone, but better control, fewer complications, reduced medication burden, improved quality of life, and greater confidence in managing the disease are meaningful goals for every patient. The best time to intervene is before complications become irreversible, because the earlier we act, the greater the opportunity to change the course of type 2 diabetes.